On the 2nd of March 2021, Nigeria received her first batch of 3.94 million doses of Astrazeneca Oxford COVID-19 vaccine, manufactured by the Serum Institute of India and shipped via Covet facility from Mumbai to Abuja. The National Health Development Agency on Monday, the 1st of March, flagged off the online registration for residents' vaccination, as this will help in monitoring and controlling the vaccination exercise in the country. On Saturday, the 6th of March 2021, the vaccine was administered to the President of the Federal Republic of Nigeria, his vice, and the Secretary to the Government of the Federation, who double as the chairman of the Presidential Task Force on COVID-19 in Nigeria. This exercise marked the beginning of vaccination in Nigeria. Good day and welcome to another interesting edition of your favorite political and current affairs program. I am Smart Simon. Today on the program, we shall be looking at the topic, COVID-19 vaccination exercise. Anything to fear? We have with us a medical personnel in the person of Dr. CHIZOBA Barbara WONODI, Nigerian Country Director, International Vaccine Access Center, Associate Scientist, Johns Hopkins BLOOMBERG School of Public Health, and Dr. EMMANUEL ABANDA, the retired Director of Disease Control and Immunization at the National Primary Healthcare Development Agency, a public health physician and epidemiologist. Also serve as a member of the National Technical Working Group of the ongoing COVID-19 vaccination, consulting for a couple of health and development organizations. They will be giving us detailed information on what vaccination means, who is qualified to be administered the vaccine, the advantages and disadvantages of this vaccine. Is there anything to fear? And more. Thank you very much for finding out time to be with us in the studio today. And you're welcome. If you can hear me,
thank you very much. Thank you very much.
Thank you, sir. Let me start with Dr. CHIZOBA. Yeah, thank you. Please, can you quickly help us and tell us what is vaccine?
Thank you. Thank you very much for having us. So what is vaccine? Vaccines are substances or biological substances that are created or made by scientists. And when it's either injected or taken orally, they induce the body to produce antibodies or defense mechanisms against the organism, either a virus or bacteria, for which that vaccine was made. So in a nutshell, vaccines help the body produce the body's own defense mechanisms against germs. So there are vaccines that are specific for different germs or different organisms. And today, you know, we're going to talk about the vaccine against COVID-19 or the coronavirus. So,
all right. Thank you so much. Now let me get to Dr. Emmanuel. If you can hear me, doctor.
Yes, I'm hearing you.
All right, thank you. What are the steps taken in developing vaccine?
All right, thank you, Smart, and everybody. You welcome to this program. My sister CHIZOBA, I want to especially welcome you and to say hello. Well, I think there are two ways I'm going to look at this. One is the second way, the second thing I'm going to consider. Are you hearing me? Are you hearing me?
Yes, sir.
Yes.
I said there are two broad things I'm going to talk about with this your question. One is the manufacturing, which I'm not going to dwell so much about. Then the other one is how do these vaccines get to us? How do they get to us? On the manufacturing, of course, there are different technologies which these vaccines are manufactured. As Dr. CHIZOBA have told you, traditionally we had some vaccines that we refer to as live attenuated vaccines. Then some are called inactivated vaccine. Recently, we had vaccines that are classified as conjugate vaccine. Just forget about the technical details about them, but there's a reason why I'm saying it. But now, with the vaccines we are using for COVID now, they are either nuclear material vaccine, mRNA, DNA vaccines, or the vector himself, or a particle of the virus that are used technologically to induce protection. So these are now there are two broad methods of producing vaccine. You ask of development of a vaccine, two broad methods. But before we look at these methods, what are the goals of developing vaccine? There are two principal goals of developing vaccine. Number one goal is safety. Safety is the number one goal. Then the number two goal is how effective is this vaccine going to be in preventing infection and in preventing disease. We call that one technically efficacy. We call it so the safety and efficacy. Now, if you have put this one aside, how then do you develop vaccine? There are two steps broad steps in developing vaccine. We have the upstream steps and the downstream steps. For the purpose of this conversation, I'm not sure it is necessary to go into technical details, but the upstream steps involve you pick a strain of the antigen, either a strain of the bacteria or the virus. You grow them in the lab. Then you go to the next step, which is called the downstream step, in which case you isolate them, you purify them, you inactivate, you formulate, you do so many other things until the candidate vaccines come out. Now, let us listen to the next step, which is the most important thing, which many Nigerians are asking. When you have gotten this candidate vaccine, what next do? You now go to what we call trials. Trials. And in trials, we have two broad types of trials. We have preclinical trials, and then we have clinical trials. The preclinical trials are those trials that you take your candidate vaccine, the small quantity of it, and you inject it to animals. They are not for human beings. Those are the preclinical stages. When you inject it in animals and you see the reaction or the dynamics in the animal, whether it is doing whatever you're doing to the animal, you are certified that yes, you have gotten what you want to get, the end point in the animal. You now go into human phase of the trial, and that's what you call the clinical trials. In the human phase of the trial, there are three broad phases. Phase one is when you get into human being, and there's a small number of people that you are going to use here, usually less than 100, and they should be healthy individuals. But the most important thing you are looking for here is safety. So you have to measure the side effects of the vaccine. Then again, you may also want to look at the dosage. of the vaccine when eventually you go to, it's not yet pushed into the market. In this dosage, you want to look at what are the possible maximum dose we are going to be using when this vaccine comes out. What are the possible minimum dose we are going to use when the vaccine comes out? If you use unnecessarily high dose of the vaccine, you may trigger a disease itself into somebody you are supposed to protect. If you use an unnecessarily smaller dose of the vaccine lower than the minimum expected, you may end up not stimulating antibody production, so you may not be able to get the protection you need. When you are satisfied with this phase 1, which use about less than 100 people, human being now, you go to what is called phase 2 clinical trial. In this phase 2 clinical trial, you use also a human being. They are also using human being, but you have moderate number of people you are going to use, usually about 100 to about 1,000 or there about that, which you are going to use. But apart from that, the addition in phase 2 is that you are now going to match your trials in demographics. Number one, you want to give it to different age group. Is it age 18 or age 20 to age 35, age 35 to age 60 and above? You also want to give it to different populations. Am I giving it to the white people? Am I giving it to the black people? Am I giving it to the Indians? You also want to give it to different different categories, maybe people who are in low socioeconomic class, who are in higher socioeconomic class, and so on and so forth like that. In phase 2 also, you want to monitor side effects. Throughout, you must monitor side effects because safety runs throughout all the clinical trials. But apart from that, since in phase 1, you have determined the maximum and the minimum number of doses, you now want to try the determined dose in phase 2. That is phase 2 clinical trial. When you are satisfied with the phase 2 clinical trial, you now go to the phase 3 clinical trial. Again, the phase 3 clinical trial is in human being. And you use large number of people, between 1,000 to almost tens of thousands. In one of the trials, I think it's the Pfizer trial, they are using as many as about 60,000 people that are used in phase 3. Again, as you do in phase 2, you match demographics, you match the age groups, you match the occupation, you match the gender, you match the racial issues, you match everything there. Again, you monitor the symptoms and signs and symptoms. Now in this phase 3, you are very careful. If anyone develops symptoms, you need to go and test using the standard test for COVID. We are talking of COVID now. That is the PCR. If they are PCR positive, that is, if they have the infection, even without the symptom, there are protocols to deal with that. If they have the infection and they have the symptom, there is again protocols to do that. The last thing I'm going to tell you about this phase 1 to phase 3 is that there is a stage where you have your real patients and of course you have your placebo. When you have left the phase 3 now, you go to in case of this COVID vaccine, you go to what we call the emergency use authorization and so on and so forth. I think I just need to leave this one like that, but these are the phases. Thank you very much.
All right, thank you so much, Dr. Emmanuel. So detailed. Thank you so much. Now, let me come to Dr. CHIZOBA. Now, doctor, if you can hear me,
I can.
How does one know a vaccine is safe for human consumption?
So I think Dr. ABANDA has really covered that in his answer. Let me just reiterate that when vaccines are developed, they are subjected to trials, preclinical and clinical trials. And during those trials, small numbers of people are given the vaccine candidates and they are observed to see if there are any adverse effects. So he laid them out. There are five phases, or five stages, so to speak. Preclinical, phase 1, phase 2, phase 3, and then post-marketing surveillance, which is also called phase 4. So in each of the clinical phases, the manufacturers are actually checking for safety, because by the time they try it in animals and they find that it works, and then they try it in the phase phase 1 clinical trial, and they see that it is safe, and then they go on to safety. Sorry, they go on to check for efficacy. It would have gone through at least 30,000 individuals before it is now certified to be used by the general public. So even after a vaccine has been licensed and is used in the general public, we continue to monitor for side effects, for common and rare side effects, or what we call adverse events following vaccination, AEFIs. So we continue to monitor. If a vaccine is not safe, it will not make it through WHO pre-qualification or emergency use licensing. If a vaccine is not safe, NAFDAC will not certify it will not certify it for use in Nigeria. So there are so many processes along the way to ensure that before a vaccine is used in a population, that it is seen and deemed and certified to be safe. And then even after that, there is still continuous monitoring. So I think this is really important to assure Nigerians that none of the safety processes or procedures or protocols were shortchanged. There were no shortcuts in ensuring that the COVID vaccine becomes available quickly and on time to the world and to Nigerians. Thank you.
All right. I must say I'm very grateful for taking your time to explain that. But still with you, Dr. CHIZOBA, why is the government more interested in the COVID-19 disease vaccine and not focusing on developing vaccine for deadly diseases like malaria, Ebola, typhoid, meningitis, that is killing Nigerians? And this disease is also a problem all over the world. But not so much has been done, but immediately so much attention has been given to coronavirus. Is there anything special we need to know?
Well, I think it's very obvious to everybody that coronavirus is different. It's a pandemic. A pandemic is something that affects every single country in the world. And the magnitude of the coronavirus pandemic is one that we have not seen for hundreds of years, right? So it's a completely, I would say, it's a catastrophic event that has happened in the world. Many people have said coronavirus canceled 2020. We've had malaria with us for a long time. We've had meningitis with us for a long time, and we've continued to go about our business, even though, yes, the government has put in place control measures for malaria, for meningitis, and all those other diseases that you mentioned. But you know, there is a difference between the damaging effect of the coronavirus pandemic and the other diseases you mentioned. So COVID-19 is not just a public health emergency, it's also an economic emergency. It's also a social emergency. There is no disease before that we know about that caused the country to close down, to lock down, to grind economic activities to a halt. This is not a sustainable way for a country or the world to live in. And that's why all efforts was brought to the table by governments across the world, by international organizations, by national organizations, scientists. Most of us in public health have been working so hard, much harder than we've ever worked before, because everybody is joining forces to see how we can defeat coronavirus. Now, with this unprecedented mobilization of action against COVID, it only stands to reason that the vaccines were developed on time, in record time. You know the number of scientists that have been working on this? the amount of money that has been injected into this. And this all makes sense because the World Bank, for example, estimates that Africa would have lost 15 billion. This was as last year, around October, would have lost 15 trillion dollars in lost productivity as a result of COVID. So this is expected. We have to make sure that with the vaccines, we can get back our lives to normal. So we know that the vaccines can protect against the disease, against the severe form of the disease, even the mild form of the disease. And we want to convert this disease that is so scary and that has shut down everything. We want to convert it into something like a common cold so that we can get back to normal lives. Thank you.
All right, thank you. Thank you, I must say. Now let me get to Dr. Emmanuel. Dr. Emmanuel, what guarantee can you give us on this vaccine, Astrazeneca Oxford vaccine? Does it stop infection? If I have COVID-19 now, for example, and I have taken the vaccine, am I free to go wherever I want to go? Will I be a danger to my colleagues, my family members, and other people around me?
All right, thank you very much, Smart. Let me just make a comment again to addition to the beautiful submission that my sister CHIZOBA made to let you know that the global community and Nigeria especially, we have not let loose or let our hands off the vaccine issues as far as malaria, typhoid, meningitis, and yellow fever are concerned.
Okay.
Already, we have gotten vaccines for meningitis, which we started using in Nigeria in 2010 through global partnership. Already, and I also know that some forms of typhoid vaccines are even available in Nigeria, though not used on wider scale. I know that there are candidate vaccines for malaria, which are still ongoing. And I also know that there are also vaccines in advanced stage for Ebola. So the world is not with, but my friend, my sister CHIZOBA said, from the public health perspective, we have just gotten only one pandemic since 1918 flu, and that is COVID. And the global practice is that once you have a pandemic by a real definition of pandemic, it will become a whole world. And I cannot recollect in my very small stay on earth that they have any the biggest scientific collaboration.
Doctor, what about Ebola? Was Ebola not pandemic?
No, Ebola was not pandemic. Ebola was not pandemic. So it was epidemic in many centers, but by definition, it was not pandemic. Yeah, that's what I want to make clear. We have gotten the the flu pandemic in 1918 and the current pandemic. Some people wanted to say, no. Now, you have asked me a question. If I've taken the vaccine, the Astrazeneca vaccine, am I safe? Am I protected? Will I infect other people? Though it is actually very rare, but it's possible to still catch COVID-19 even after you get the vaccine. That's the scientific truth.
So what is the essence?
Wait now. The truth can be different from the reality. The reality is that once you take the COVID vaccine, you have more potentiality of greater protection, especially when you complete the 2 doses. Now, let me tell you this. Taking the vaccine, it's like saying you are staying in the house. If I stay in the house and I'm wearing fireproof bullet and everything, proof bullet, will I stay in the house that is burning? No. You cannot stay in the house that is burning because you are wearing a fireproof bullet. So you take the vaccine, which you confer some degree of immunity by and large. And if at least 70% of a given population have taken the full dose of the vaccine, scientifically and by various models and by history, we know that the society is fairly safe from the disease. Let us look at what happened for smallpox. When the whole world had a very good herd immunity, smallpox was eradicated. The same thing with polio, when everybody is trying to eradicate polio virus community. However, it has been found out that when you take this AstraZeneca vaccine, nobody has ever taken it in the world. We are just starting to take it. So we are still following up on what will happen. But we know from various models and studies and projections that those who take the vaccine, even if they develop a disease at all, the disease will not be as strong, as severe as it should be. And they are also less likely to transmit the infection to other people. Then taking the vaccine does not stop you, please, from obeying all the guidelines of hand hygiene, face masking, keeping safe distance, and so on and so forth. So if you take the vaccine, you are better protected and you are protecting more people in your environment than yourself. But the full profile of how the whole thing is going to be, just like any other vaccine, we are seeing it. Thank you very much.
All right, thank you so much. So even after taking this vaccine, you are still expected to observe all the COVID-19 protocols.
Yes.
Okay.
Yes.
All right. Thank you so much. I think that our audience need to get that very, very clear, that taking this vaccine is not a guarantee that your life will now come back to normal like we used to be before. It will no longer be so. All right. It appears Dr. CHIZOBA want to say something on this.
Yes, I do. The thing is that there's not enough vaccine in the world right now, right, to go around. So Dr. Abanda said by the time we get 70% of the population vaccinated, then we expect that we'll have what we call herd immunity. And so that's when we're looking at, the world going back to normal. So it's not, I didn't want you to leave it that, yes, even though we take the vaccine, we will still not have our lives back to normal. So we just need time. Yes, we just need time to have enough people vaccinated and transmission reduced. Before we expect that we can get back to normal.
All right, thank you so much for making that clarification. Now, still with Dr. CHIZOBA, what are the advantages and disadvantages of the Astrazeneca vaccine?
Okay,
because there has been complaint in some places. For example, now in Austria, we learned that a woman took the vaccine and she died. So the government of Austria suspended AstraZeneca vaccine in their country. There are also other reports, like in South Africa, that people who took the vaccine are dying. This is allegedly, please. I don't have the facts here. But so what are the advantages and the disadvantages of this?
Okay, let me say that I have not heard that people who took the vaccine in South Africa were dying. I have not heard any of those reports. I've gone through the clinical trial documents where everybody, more than 30,000 people who took the vaccines, were followed up very, very closely and compared with those who did not take the vaccine. And there was not a single case of death in the clinical trials. And even now that the vaccine has been rolled out, millions of people have actually received the Astrazeneca vaccine. And I have not heard about deaths. Deaths will always happen. And, whether people take vaccine or not, death is something that happens to individuals. So in the context of taking vaccines, what they try to do, if somebody dies, they try to ascertain whether that death was linked to the vaccine or not.
Okay.
So that is something that we need to get first before we can determine whether the person who died after taking the vaccine was actually killed by the vaccine. So it's very important for us to make that distinction. And like I said, in the clinical trials I've followed thousands of people, there was not a single case of death in the AstraZeneca trial. Now, coming to the South Africa story, what we know from South Africa is that they have variants. This virus always mutates. Viruses mutate.
Okay.
And so the coronavirus has been mutating recently, and there was a particular strain that, emerged in South Africa, that the Astrazeneca vaccine, when they looked at the data, they found that it did protect against severe disease, but they didn't have enough data to show if it protected against mild disease. So not having enough data is different from saying conclusively that it did not. Nonetheless, the government of South Africa decided to go with another vaccine because they didn't have the data to show that it protected against mild disease of that particular variant. Just let's be clear that it is the variant, and the variant is, it's fairly prevalent in South Africa. So that's the story with South Africa. It's not about people dying after taking AstraZeneca. It's just about it not protecting against mild cases of the variant. So that's the disadvantage part you mentioned. On the advantages, AstraZeneca has a lot of advantages for our context. It has very high efficacy. In fact, before the trials were concluded, as the vaccines were being manufactured and the scientists were putting together their what should I say, a wish list. They said that, in fact, even the WHO said that we will be happy with a vaccine that gave 50% protection or even 60% protection. This was before the clinical trials. So the world was going to be satisfied with vaccines with 50 or 60% efficacy. But what we have now are vaccines that have surpassed those benchmarks. So having 72% protection or more is good, is very good. It's very, very good. And then the other thing about it, so AstraZeneca has high efficacy. The other thing is that it is affordable. It is cheaper than the other vaccines, than Moderna, than Pfizer. So it is affordable for many low and middle income countries. Another thing is that the vaccine is can be transported and can be stored within our existing cold chain system. So we don't need to go buy ultra cold storage for it. So the cold chain system that we have is good enough for the AstraZeneca vaccine. And, there you go.
All right. I was going to ask you that what can you say about the preparedness of the government in storing and administering the vaccine? But I think that you have just answered that question. So we will no longer be afraid that the power failure will cause a major concern, right?
You're right, correct. The government, the National Primary Healthcare Development Agency, they've been on this vaccine business for a long, long time. In fact, I have to tell you that Nigeria is actually better placed than many other countries. Why? Because we've been battling polio for a long time. Yeah. So we are battle won. Know what we know about vaccines. We know how to deliver vaccines. We do know how to deliver vaccines. So we have the infrastructure. So the many years of polio eradication effort has really equipped the National Primary Healthcare Development Agency around vaccine logistics, vaccine delivery, vaccine and accountability. So we have the cold chain system at the strategic cold store, in the zonal stores. Every state has cold stores. Every local government area has cold stores. Many health facilities have fridges and freezers to make the ice packs, fridges to keep the vaccines. And the facilities that don't have, they have what you call vaccine carriers, where you put the vaccine in the vaccine carriers and line them with ice and move them. It maintains the cold chain. In addition to that, they don't, there is also what we call temperature monitoring. So each of those fridges have temperature monitoring to make sure that the temperature is maintained throughout, and it keeps a log of the temperature in the fridges. And that log, the cold chain officers can go back and check and see if there's been any, they call it temperature excursions, like if the temperature has gone beyond the 2 to 8 degrees Celsius that it was supposed to stay in. And another thing is that each vaccine vial has what you call a temperature vaccine vial monitor. If the vaccine vial, if it steps out of the temperature range, that thing will change, that indicator will change. And before a vaccinator gives anybody a vaccine, they check that monitor to be sure that it's within the range. So we have all these systems in place. And it's really assuring for me, and I want to also assure Nigerians that these systems have been used for many years to vaccinate children. It's also the system that we're leveraging on to make sure that the COVID vaccination will be deployed effectively, safely, and to reach everybody.
All right, Dr. CHIZOBA, I must say I'm very grateful for your time right now and for clarifying these issues. Now, Dr. ABANDA is not online anymore, so I will dwell more with you.
Okay.
Yeah. Okay. So the next is, who are those qualified to take the vaccine? Am I qualified?
Okay. Well, I'll tell you the list now, and then you can let me know if you're qualified.
Okay.
Okay. So, first of all, the vaccines were tried, the trials were done, and it is recommended for people 18 and above. So this is the Astrazeneca. Some of the vaccines go to 16 years and above. But because there is not enough vaccine in the world, and also in Nigeria, there is, it's being rolled out in a, should I say, in a priority fashion. So the NPHCDA has determined that there are some people who will get the vaccines first because they are just few doses. We only got, what, 3.9 million doses, and there are 200 million Nigerians. So so they have 4 phases of vaccination: phase 1, phase 2, phase 3, and phase 4. In phase 1, the people who are going to get it are frontline workers, frontline healthcare workers. So frontline healthcare workers, if you're a healthcare worker, you're working with patients, particularly COVID patients, you're first in line. If you're frontline worker, you're working in at the borders, air, sea, land border, you're also front in line. In phase 1 also, you have the police, you have the military, and then you have people who work in petrol stations. So what they've done is to prioritize those people who are public facing, who come in contact with a lot of people. That means their risk of exposure is high. So those are the people in phase 1. In addition to phase 1 are what they call strategic leaders. These are leaders who, when they get vaccinated, the public gains confidence in the vaccine. So that is phase 1. And that's what we are dealing with right now. In phase 2, they are going to vaccinate older adults. You know, the coronavirus is more severe in older adults. And in Nigeria, they found that the right cutoff is really 50 years and above. So if you're 50 years and above, you will be vaccinated in phase 2. In addition to that, if you're a younger person that has what we call comorbidities, it just means you have other conditions like high blood pressure, diabetes, cancer, and all that, you will also be vaccinated in phase 2. Phase 1, frontline health workers. phase 2, older adults and people with comorbidities. Phase 3, they will then mop up all the other people in phase 1 and phase 2 who did not get the vaccine the first time. They will mop them up in phase 3, make sure that all those priority people are covered. And then in phase 4, it will now be the rest of the population as vaccines become available. So what this does in essence is that it primarily, or it protects those that are highly exposed by virtue of their job, and then those that will get very sick by virtue of their age, and then those that will get very sick if they're infected by virtue of the other conditions that they have. And those are the people that are protected first with the few doses that are available. And then as more global supply becomes available, then they will vaccinate the rest of the population.
All right, Dr. CHIZOBA. Now, who are we going to be holding responsible should anything wrong happen to any of our people? For example, if I have a frontline worker in the family or an other person who has taken this vaccine and something happened, what will happen? Should that be that we are left with our faith?
So I know what you're asking. You're asking about compensation and indemnity and all that. First of all, so first of all, once as the vaccines are being rolled out, there's something we call pharmacovigilance, which is tracking who has gotten the vaccine to see if there are any adverse effects. I mentioned that earlier. And what the government has done is really exciting. What they've done is they have repurposed a mobile app that's used by NAFDAC. So people can track and report their symptoms or any sign they get after getting vaccinated. They report it to a central server, and then there's a committee that looks at that data to understand if there are some trends in adverse effects and all that stuff. And this is really to give the public the confidence that even after you're vaccinated, we're watching. We're watching to see if anything will happen. And if something happens, if they get a report of an adverse effect or a potential adverse effect, they will investigate. They will investigate to find out if it really is from the vaccine or is from something else. If it's from the vaccine, of course, they will offer treatment and remedial action. If it's from the vaccine. If it's not from the vaccine, they will also explain to the individual what could have caused it. So there is a system in place to continue monitoring people who have received the vaccine so that they can report to the Pharmacovigilance Center. So the other thing you talked about is, are we going to be, so if we're injured by the vaccine, are we just going to go like that? That is really, I wish Dr. ABANDA was here. That's really a question for the government to respond. But I know that in the US, for childhood vaccines, they have something they call a vaccine compensation fund, where there is, funds set aside to support either families or individuals who have a vaccine injury. And that's determined, after investigation and all that. But I'm not sure if there is a similar thing here in Nigeria, but I do know that the government is alert to monitoring, to check if there are adverse events and to take remedial actions in case of that. Over.
All right, thank you so much. Now, let me ask you this now. I don't know whether you'll be the right person, but Dr. ABANDA is not here. And I'm not sure now, when was the last time you were in Nigeria? But let me ask you this.
October last year.
You can contribute this. Oh, just last year?
Yeah. I'm still also involved in the vaccine rollout in Nigeria. Just the way I'm talking to you via Zoom. That's how I attend meetings too.
All right. So, what is the possibility that this vaccine won't be looted by the politicians?
Zero possibility. Did you hear me?
All right.
I said zero possibility.
Yes, I heard you. But why do you have so much confidence that it's zero possibility?
Because you said looted, that means somebody is going to cut it away from where it's stored. Because when the vaccines arrived, they had their own security. The vaccines had security, moving from the airport, yes, to the cold store. And everywhere the vaccine goes, there is security for the vaccine, because we know this is a hot commodity. Can you hear me? I'm saying that the vaccines have their own security detail.
Hello.
The vaccines have their own security details. When they are being moved from point 1 to point 2, they are accompanied by security, because we know that these are highly valued commodities, and nobody is going to snatch the vaccine in transit. And also, the cold stores are, secure; they are protected. And then the final thing I want to say is that I don't think Nigerians should be concerned too much about political leaders getting the vaccines on time or before other people. Because as I've laid out to you the priority groups, you will agree with me that most politicians are 50 years and above. Wouldn't you say so?
Yeah.
Yes. So they would fall into that phase 2 category anyway, just as other people who are 50 years and above. So that's the thing.
All right. Now, can one who has taken the vaccine contract the COVID-19 virus again? Can we make this very clear, this point?
Yes, Dr. Abanida had mentioned that before. There is first of all, I want to say that it is possible, but it's highly unlikely. It is possible, but it is unlikely that when they contract it, they will become sick. Because think about it this way. We are exposed to bacteria, viruses every day, right? You breathe in air, you breathe in droplets, and you get the virus in your nose. Your body's defense mechanism interrupts the process in your nose before it even gets into your body, before it turns into a disease. So it is possible that even after you get vaccinated, you can be exposed to somebody who sneezes, who has COVID, and you inhale it. But the thing is it going to turn into an infection for you? It's highly unlikely that it will result into an infection, because you already have the antibodies. Your body already has the defense mechanism that will stop it in its track. So when you hear that you've taken the virus, you still protect yourself, the reason we're saying that is that number one, not everybody is getting the vaccine at the same time, right? And then number two, there's also that possibility of the infection. But the truth of the matter is that the vaccine actually reduces considerably your risk of infection. And of course, it also reduces your risk of transmission. It reduces your risk of getting severe disease. Recently, the CDC came out with a new guideline. I don't know if you've seen that, where they say that in a place where everybody has been vaccinated, right, that they can, kind of let down their guard a little bit, where everybody has been vaccinated. So I don't want to confuse Nigerians by saying this. I'm just saying that to answer your question. The policy still is, even if you're vaccinated, wear mask, social distance, wash your hands, because it's going to take a long time for everybody or for most people to be vaccinated. Does that make sense?
Yeah, it does. Thank you so much. Now, as we round off, how can Nigerians apply online for the registration of the COVID-19 administration? And then your advice for Nigerians on the ongoing vaccination exercise. So your advice will be like your final words. Can you quickly make your summation?
So go to NPHCDA website. You can just Google National Primary Healthcare Development Agency, and their website will pop up. You click on it, you will see the link to register. And the link to register is also being shared on social media, WhatsApps and all. When you click on the link, it will ask you your age, and it will ask you a series of questions. And if you're 18 years and above, you will go through register, and then if you're in phase 1, it will give you your vaccination number, and then it will schedule you for vaccination. If you're in phase 2, phase 3, phase 4, they will send you a text message when it's your time to get vaccinated. Okay, so go online or MPHCDA website, you'll see a link and just follow the directions.
Yes.
My advice to Nigerians is that we should, number one, continue to observe the social distancing, wearing mask, washing hands, because COVID is not over yet, but we are at the beginning of the end. So we need to continue to protect ourselves. Number 2 is a lot of harm can be done by forwarding false information, misinformation. Let us not be part of that chain of transmitting misinformation. If you have, all these conspiracy theories forwarded to you, just let it end on your phone. Don't forward it further, because a lot of the conspiracy theories are actually causing fear and anxiety in people about the vaccines. Number 3, go to MPHCDA, go to WHO, go to NCDC website for the accurate information. It's very easy to go to their website and get accurate. When in doubt, ask somebody who is credible, who will give you the accurate information. And then number 5, I think that's number 4. Number 4 is continue to support the immunization program, and say your prayers for Nigeria. We will also overcome this. As they say, this too shall pass. Thank you.
Yeah. Thank you so much, Dr. CHIZOBA. I am so appreciative of your time. I noticed you've been standing all through.
Yes. Oh, is it obvious that I'm standing? Yes.
No, from yeah, it looks obvious.
Yes. I prefer to stand.
You are a strong woman. Thank you so much for your time.
My pleasure. Thank you for having me.
Yeah. Okay, this has actually done so much to a lot of people who have been afraid of this vaccine thing.
Yeah, they shouldn't be.
And we appreciate all those who join us online via Zoom, YouTube, and other social media handles. We appreciate Dr. Emmanuel ABANDA as well, though at some point we could not connect with him again. Thank you so much for your time. We may call you again, Dr. CHIZOBA.
No problem, I'm here. Thank you.
All right, thank you so much. Now, from the submission of this expert, you can take decision on what you think would be the right thing. Thank you so much. And this is where we bring the program to a close until we come your way again. Same time, same station next week. Please, if you have the privilege to be vaccinated, do make yourself available. I remain Smart Simon.
The views and opinions expressed on this program are those of the guests and viewers and does not necessarily reflect the views and opinions of the Advent Cable Network Nigeria, ACNNTV.